6 ways to reduce your heart attack risk. Heart disease is the number 2 killer, resulting in approximately 275,000 deaths annually. But you can dramatically decrease your chances of having a heart attack, and other vascular complications like a stroke, simply by knowing and addressing the most important risk factors for heart disease. 1. Stop smoking. If you smoke, stop. If you can't do it on your own, utilize the many tools, both behavioral and pharmacologic, to help you. Quitting smoking is one of the biggest favors you can do for your heart. One recent study found that not smoking lowers your risk of a heart attack by more than 1/3. 2. Eat Mediterranean. Again and again, clinical investigators have found that a Mediterranean diet lowers your risk of heart disease and overall mortality. The diet is easy and delicious, consisting of whole grains, fruits, vegetables, legumes, fish and low-fat dairy products. Key components include nuts, olives, olive oil and red wine in moderation, 1 to 2 glasses per day for men, 1 for women, which have independently been shown to reduce your risk of heart disease. In fact, the positive impact of the Mediterranean diet is almost as great as not smoking. 3. Exercise. It's a no-brainer. Physical exercise will help keep your heart healthy. Set a realistic goal to exercise for half an hour 3 times a week. It's enough to reap many of the cardiovascular benefits of physical activity. Additional exercise is better to a point, but going overboard with strenuous daily workouts may actually undo some of the benefits, so be careful not to overtrain. 4. Stay lean. Accumulating fat, particularly abdominal fat, is a big risk factor for heart disease, so this is another reason to eat right and exercise. 5. Get social. Psychosocial factors play an important role in limiting your risk of heart disease. Stress, anxiety and depression all increase your risk. Having a strong social support network, friends, family and colleagues, lowers your risk. 6. Consider prescription medications. If, despite your best efforts at improving your lifestyle, your blood pressure or cholesterol profile is still out of whack, see your healthcare provider. Medications that lower your blood pressure and your LDL cholesterol, the so-called bad cholesterol, have been shown to reduce your chances of a heart attack or stroke. Similarly, if you are diabetic and haven't been able to control your blood sugar with lifestyle changes alone, make sure that you and your healthcare provider are working together to improve your blood sugar control. The majority of heart attacks and strokes occur in people with at least one risk factor. The more factors you have, the greater your risk. Many of these risk factors are largely under your control. The year is still young. Make a resolution to follow a heart-healthy path, and make an appointment with your healthcare provider if you need guidance. 8 signs you may have a blood clot that can lead to heart attack or stroke. One of the functions of our body is to protect itself. For example, if there is bleeding or a cut, the blood gets thicker in order to prevent bleeding. Nevertheless, the cause of these blood clots is not known and it can cause heart stroke or heart attack. Here are some symptoms of blood clots that you should be aware of. What does a blood clot represent? Blood clots represent clumps of blood, which has transformed from a liquid to a semi-solid or gel-like state, formed by fibrin and platelets to prevent bleeding. If a blood clot is formed in our body, it does not dissolve alone. For this reason, it can be a really life-threatening health issue. When a blood clot forms in the veins, it causes deep vein thrombosis, DVT, which is most common in the legs. However, it can also occur in the arms, lungs, pelvis and the brain. Namely, if a blood clot breaks down and gets to the lungs or heart through the veins, it may get stuck there and prevent blood flow. Pain and tenderness in the legs. It is one of the most common symptoms of blood clots. Other symptoms of blood clots in the legs are bluish or pale discoloration, burning sensation, tenderness, and swelling of the legs. These symptoms vary on the clot size. Swelling in the legs. Swelling may cause vein thrombosis. In case of vein thrombosis, the oxygen and blood flow is blocked. If you notice this symptom, you should consult a doctor. Shortness of breath and lightheartedness. Even though blood clots are less common in the heart, they sometimes can occur. A blood clots in the heart leads to chest pain, as well as shortness of breath and lightheartedness. Pain in the chest. Chest pain is a symptom of blood clots in the lungs. If you notice this symptom, you should consult a doctor. Abdominal pain. A blood clot in the abdomen is manifested with swelling and abdominal pain. However, These may be also symptoms of food poisoning or stomach virus. Breathing difficulties. If a blood clot appears in the lungs, it is known as a pulmonary embolism, P. Shortness of breath as well as difficult breathing are symptoms of blood clots in the lungs. If you experience coughing, blood, chest pain and increased heart rate or palpitations, you should consult a doctor. Red streaks on the veins. Blood clots can be manifested as skin bruises. If you notice red bruises on the skin, you should consult a doctor. Unexplained cough. If there is no reason for your coughing, you should take care of your heartbeat and breathing. If you notice some symptoms, you should consult a doctor. What are the risk factors of blood clots? The risk of getting blood clots is increased with some factors, such as smoking, obesity, cancer, certain medications, like birth control pills, history of blood clots, genetics factors, pregnancy, high blood pressure, heart conditions, like a heart rhythm imbalance and atrial fibrillation, diabetes, high cholesterol levels, age, particularly over the age of 65, long travels, when you have to sit for a long period of time or being sedentary. Blood clots can be deadly. In case you notice some of the symptoms mentioned above, you should consult a doctor immediately. Top 5 foods to eat for cancer prevention. There is no doubt that eating healthful foods void of pesticides will boost overall health. In fact, this is why many individuals choose to shop organic, at least when it comes to buying fruit and vegetables. Eating more of these powerful foods could reduce your risk of developing obesity, heart disease, and even cancer. Luckily, many of the top researched cancer-fighting foods are both easy to find and simple to incorporate into your diet. As I reported just a few months ago, some anti-cancer foods work at a cellular level, fighting tumor angiogenesis. This means they fight the process by which tumors grow new blood vessels, and, therefore, grow themselves. An entire class of drugs addresses this method of growth, but so do some of these anti-cancer foods. 1. Foods rich in lycopene. A recent study in the Journal of the National Cancer Institute specifically looked at the effects of lycopene on angiogenesis in prostate cancer. They found remarkable results, determining lycopene was associated with reduced risk of lethal prostate cancer, and with a lesser degree of angiogenesis in the tumor. So, what foods give you the most lycopene? Tomatoes are a great source, and are widely available. Other good sources of lycopene include watermelon, guava, papaya, red bell peppers, asparagus, mango, and red cabbage. 2. Turmeric. Turmeric is one of the most powerful, researched anti-cancer foods out there. Its active component curcumin has been found to reduce certain types of tumors by 81%. Researchers at UCLA found that curcumin is the component harnessing the ability to actually block cancer growth. Not surprisingly, the cancer-fighting ability that turmeric possesses makes up only a single facet of the many benefits of turmeric. 3. Garlic. Like turmeric, garlic is a powerful root known for providing a wide range of health benefits. Allicin, the active component, selectively targets cancer cells, while leaving healthy cells alone. Make no mistake, healthy people who incorporate garlic into their diets have a decreased risk of developing cancer. Even though doctors cannot detect where metastatic cells have migrated and lodged themselves, says Professor Morellman, the antibody-linacylin combination should chase them down and destroy them anywhere in the body. 4. Ginger. Related to turmeric, ginger joins the lineup of potent, anti-cancer roots. One study from Georgia State University found that whole ginger extract was able to reduce prostate tumor size by 56% in mice. It is also an anti-inflammatory agent rich in antioxidants. 5. Cruciferous vegetables. Cruciferous vegetables like broccoli and cabbage are rich in sulfur-containing antioxidant compounds shown to fight cancer. Research from Linus Pauling Institute shows that these compounds work to fight carcinogens, cancer causers, before they have a chance to damage DNA. A diet rich in foods like these may not only reduce your risk of cancer, but other lifestyle-related diseases as well, helping you to reach optimal health.